9:14 now. People spend lots more time outdoors this time of year, the beach, the pool, as it warms up. It's especially important to protect your skin. Dr. Sarah Schwertner with Primary Care Plus joins us to talk about the warning signs of skin cancer. Good morning.
Good morning.
Very serious issue.
Yes, it is a very serious issue.
A doctor told me once, the skin cancer you might be getting, or the pre-cancer that might be showing up, maybe is from the sunburn you got decades ago.
Yes, studies show that a sunburn before the age of 18, your risks of having skin cancer in your life are almost tripled.
So it's a really serious issue for moms and dads. Make sure you lather up, because you're actually, you might, a lot of conditions you might look at and say, they're kids, they're fine. But that's when you might be doing the most harm.
Right, so make sure you put the sunscreen on them.
What exactly causes skin cancer?
So skin cancer is from repeated exposure to UV lights, and that can be from tanning beds or the sun. And what happens is the cells actually change, they kind of mutate, and then they start to grow and they form cancer.
Melanoma is the more serious version. What are the differences really between melanoma and non-melanoma skin cancer?
So there's melanoma, non-melanoma. Melanoma, it grows rapidly. It can spread to all the organs in your body if you don't catch it in time. Non-melanoma is basal cell carcinoma is a type, and so is squamous cell carcinoma. Those are the most common types.
And it can spread to an organ or someplace that you don't even see any sign of it necessarily. So which makes it doubly important to really stay on top of the issue with a dermatologist.
Absolutely. So you can check with your doctor if you're concerned about a certain mole. It looks different. It's starting to change, and if you can catch it and get it removed in a decent amount of time, then it won't spread to your organs.
What are the signs? What do you look for?
So we like to use the ABCDE method from the American Association of Dermatology. So you want to look for asymmetry, something that is not symmetrical. You want to look for the border is irregular shaped, the color is changed.
Irregular shape.
Irregular shape, and then the color is changing or has two different colors in the mole. And then you want to look at the diameter. Anything bigger than a pencil eraser, it's probably could be cancerous. And then E is evolution. So if it's changing, something just doesn't look right.
Gotcha.
Make sure your doctor checks that out.
So it's important for you or your loved one, somebody, you can either do it yourself and then especially a doctor periodically, to kind of look and see what's happening to the largest organ in your body, your skin.
Yes. Definitely get your mole checked at least once a year. I recommend skin checks once a year.
The ABCDE rule, does that always work?
Sometimes it doesn't work. Sometimes a mole can just be a different color. It can be white, can be black, can be brown. Just look for anything that is out of the ordinary or new and get that checked out.
We talked about it a little bit, but let's go back and circle back and talk about prevention. How do you prevent this?
Prevention. So try not to be in the sun for long periods of time. If you have to be in the sun, make sure you're wearing an SPF of 30 or more. Wear hats, sunglasses, even lip balm with an SPF in it, or even wear long sleeve shirts. That can help protect your skin.
I love baseball caps. My wife would say, she would tell you about my collection of baseball caps, but I've been told that, yeah, that's better than nothing, but really, you really are better off with the
wide-brimmed
cap.
Yes, the wide-brimmed hats. So yeah, you see the people out there who mow grass and they have these big hats on. That's really good for protecting your skin.
They're the ones who know what they're doing.
Yeah, exactly.
But a baseball cap will help.
It will help, somewhat.
All right, Dr. Sarah Schwertner with a really important message. We appreciate that.
Thanks for having me on the show.
Take care of your skin.